Well, to shed more light on the conference, we have the pleasure to have with us over the phone our dear guest, Mrs. Amany Holla, the Human Development Expert. Good afternoon. Hello?
Hello?
Hello, Mrs. Holla.
Hi, how are you?
Thank you so much. Mrs. Holla, how did you follow the conference today and the statements by President Abdel Fattah al-Sisi showing how Egypt have faced several challenges, especially in the field of health, facing the hepatitis C since the year 2011, and also the challenges that Egypt have faced since the revolution of 25th of January?
Actually, we can say this is a very successful step to put a hand on a very weak point we used to suffer from, which is the difference and miscoordination between different fields, which are coordinating together and are very important to each other to achieve much better results than working in isolated islands.
Yes.
So,
yes.
So this step and this we can say selection of different specialties together to work together in a harmony makes big difference and bringing much better results than working separately.
Yes. Also, during the conference, in his word before the conference, President Abdel Fattah al-Sisi said that the Egyptian state have exerted several efforts and provided a big budget for the health sector, and Egypt was able to stop completely the hepatitis C, and was awarded even for this. The efforts exerted concerning the hepatitis C, how did you follow the statement by the President?
You cannot the big steps we have already achieved in different fields. They are all together helping in development and working to serve the population, starting from housing, health, education, entrepreneurship, improving the skills and the conditions of poor people in different and integrated fields. We work hard. Still, we have a long way to work in, but we achieved very good steps.
Yes. Also, the President spoke also concerning that the World Health Organization have also provided Egypt with all help and with all support, and said that Egypt became a role model for the African continent. How did you follow these words?
Actually, there are very strong models and very successful stories about what we achieved in Egypt, starting from hepatitis C, which was like a miracle to save almost 50% of the population used to suffer from this disease and making them disabled. Now we are the model for people in different continents. Even we have receiving patients from America and European countries to be treated here in Egypt. This is very obvious and strong model of what we achieved, and also the campaigns, different presidential campaigns concerning the citizen health is continuing one after another, making a very big difference in taking care of the population health.
Yes. Mrs. Holla, also during the session that was monitored by the Minister of Population and Health, Dr. Khaled Abdel Ghaffar, there was speeches by the ministers of Iraq, Health Minister of Iraq, and also Health Minister of Palestine, during which he thanked the Egyptian state for its support for Palestine, and also the Iraqi minister also said about the experience of Iraq and the efforts exerted, the importance of this session in exchanging the experiences and benefiting from this session.
First of of all, we have to show our support and our very clear situation towards our national and cases we have to be clear on, especially when it touches the humanity and the people of our nations. So it's very clear message about our situation and about what we are trying to say in this point. And of course, they need all our help, and we are there to help them as much as we can, because unfortunately we are a little bit hand tight because of the international support to the other people who are trying to make the problem stronger and stronger.
Yes. Also, the Minister of Health and Population, Khaled Abdel Ghaffar, delivered a speech also, and he was monitoring the session and said that Egypt is the world, a cradle of the world civilization and the land of peace, and has served as a bridge between peoples and enriched humanity with a creative benefit for the humanitarian values. How did you follow his words?
This is expressing what we are really feeling, starting from the very simple citizen up to the decision makers. We are all in one heart, feeling the same feeling and trying our best to achieve as much as we can to express what we are thinking of and what we are believing in.
Yes, the conference have gathered a large number of officials from Egypt and around the Arab world and Africa also. Also gathering was the ministers, as I've just mentioned, ministers of health of Lebanon, Palestine and Iraq, and also Greece, and also Minister of Human Development, and also representatives from the United Nations and Prime Minister of Egypt, Dr. Mustafa Madbouli, and also Arab League Secretary General Ahmed Abul Ghait, and also Egyptian Foreign Minister Badr Abdel Ati, the importance of this gathering and the participants.
Hello?
Hello?
Sorry, I didn't hear.
Yes, would you like that I repeat the question?
Please,
hello?
Sorry, I couldn't receive it.
Hello?
Yes, please.
Yes, Mrs. Holla, the participants and the gathering of a large number of officials, whether from Egypt or the Arab world, the participants and officials from the Minister of Health of Iraq, of Palestine, of Lebanon, of Greece, also representatives from the UN, and also the Arab League Secretary General Ahmed Abul Ghait, and other officials from Egypt, Prime Minister Mustafa Madbouli, and also Foreign Minister Badr Abdel Ati, who also delivered a speech. The importance of this gathering in exchanging point of views and benefiting from it.
Of course, Egypt is trying to renew the international commitment towards the population issues and the efforts to achieve maximum benefit from the demographic changes and divisions. And this is, will not come easily without a lot of efforts and a lot of workshops with the other parties, and trying to convince them with our way of thinking, and trying to make a united decisions to achieve better results.
Yes, the importance of the title of the debate today during the session was benefiting from challenges, human population at times of crisis, which is a very important topic, of course, as usually states have a certain plan or a certain program for example, economic reforms or something, but at the same time there are internal challenges. So give us an idea about the importance of this title. I'm going to repeat it again: benefiting from challenges, human population at times of crisis.
Of course, if we have experts from different countries, from different cultures, thinking together and adding the experience to one to another will help to produce better ideas and to find better solutions to the problems. This is what our Congress are made for, just to achieve and to give a better way of thinking and collecting the brilliant minds and the best experiences, the decision makers, the entrepreneurs, even the identities who are helping, like United Nations and USAID, are all working together to achieve better results and to discover weak points and trying to find solutions for them.
Yes. Mrs. Holla, Egypt is adopting a strategy for the human development and improving the characteristics of demographic. What are the pillars of this strategy?
This is very important point because we used to have different changes in cultures and even in the weather. There are completely different ways to solve different problems according to the environment, which will be a very good added value to the discussion when people are expressing the differences of their cultures and what they are need to achieve better results.
Yes. Mrs. Holla, what is the importance of the human development in supporting a sustainable future?
This terminology actually is a little bit new for the international conferences. What is very important to understand the mentality and the skills of people and how to improve them, because we used to work on concrete things and taking care of the human nature and how to help them to develop. Yes. Is very important, but used to be not in the focus for many decades.
So what are the axes of human development that the conference is discussing?
It's a very sophisticated point to talk about, because human development is divided into many fields, and each field must work together with the others to coordinate to produce a good result. So the human development, starting from vocational and educational and even health care and awareness to make people understand what they need and avoid the hazards they don't recognize sometimes. Yes. Is very important, and this is a very big field to talk about, and needs a lot of experts to get results out of it.
Yes. Mrs. Holla, the conference focuses on health and education mainly, as it includes, of course, a large number of experts in this field. So how do you see the state of Egypt's interest in the sectors of health and education in recent years?
Of course, we have a very strong jump in these fields, and especially with the new universities and taking care of the new specialties, which are very important according to the differences happening in our time. So when you are talking about 37 different specialties are working together to achieve the better connection between each other, because everything is related in this world, but we need to find the right contact and how to work together instead of being separated.
Yes, during the President Abdel Fattah al-Sisi's word before the conference today, the President said in the year 2011 the Egyptians were 80 million citizens, and now they are 106 million citizens. And he said that 100,000 100 million citizens have benefited from the health initiatives that Egypt have launched. How did you see this point?
Actually, it's a lightning point, and it is a really strong success. Nobody can deny, even the people who are against what's happening now, they cannot deny the miracle of virus C, the great efforts with the different trials to help people, especially with cancer, with a lot of campaigns made for chronic disease, and it made a very big difference and achieved a lot of success in this field.
Yes, also for his part, the Minister of Health and Population, Dr. Khaled Abdel Ghaffar, said that the healthcare quality being offered to citizens have improved across Egypt and across all governorates. And also he said that, which is including the comprehensive health insurance program. Also, as we can see in recent years, Mrs. Holla, that Egypt have provided, or the state of Egypt have provided also health insurance to citizens, even to citizens who are not employees or working in the government. So how did you see this? Also the initiatives by President Abdel Fattah al-Sisi concerning the early depicting of the diseases, and also facing the chronic diseases, and also facing the waiting lists, as President Abdel Fattah al-Sisi mentioned today, the waiting lists for the patients.
We used to suffer from centralization in many fields, especially in healthcare. Can you imagine people in the rural areas and in the little bit far governorates? They are suffering a lot, no care, no even to find their ways to reach the central healthcare centers is very difficult. Sometimes they cannot go, and they lost their lives because of lack of healthcare. So what's happening is great step towards them, and now the campaigns are reaching the very far areas and the deep villages everywhere. They are distributed in a great way, to the extent that almost 1 million of our population have received some kind of health care, which is a great step.
Yes. I thank you very much for your time. Thank you for your valuable information, Mrs. Amany Holla, the human development expert. I really had the pleasure to have this phone with you. Ladies and gentlemen, a short break and I'm going to be back with you.